Yeah. So our project is on the water-related skin conditions that affect infants. So like um, skin conditions that they can get from baths and stuff. So in your home, so not like recreational, like swimming pools and stuff.
Okay.
But it's like how they affect their skin.
Okay. Yeah, so a little bit of background information is so full birth infants are generally born with competent skin barriers, but it is still developing through that first year. And up until 2 years is when their skin barrier properties start to resemble that of adults. The skin is made up of many different parts and many different layers. That top part is the epidermis, which is made up of even more layers. And then for the sake of our discussion, when talking about skin barrier functions and water-related skin conditions, the stratum corneum, which is the top most superficial layer, plays the biggest role. Infants have a thinner epidermis, which is that top layer, and a thinner stratum corneum, which is the top most superficial layer of the epidermis. And then there's also something called TEWL, which is transepidermal water loss. And that's how we measure the amount of water that escapes that stratum corneum. And infants tend to have a higher TEWL, which means that they lose hydration a lot quicker in adults. And all of that is important because it, of course, disrupts their barrier quicker, and it all ties together. And then, of course, like a lot of studies, you won't find a lot of studies on infants since these are limited. Studies in infants are limited, obviously, due to ethical and safety issues. No one wants to do scientific experiments on babies. So going back to your first question, what are some of the most common water-related skin conditions that affect infants? The most common and the most obvious would be atopic dermatitis, which is eczema. And then related to that would be irritant or contact dermatitis. And then a little bit less common in terms of water related, but still kind of water related because of all the moisture that gets trapped into diapers, would be diaper dermatitis.
Thank you. So when you're dealing with eczema, how would you approach that treatment considering how delicate their skin is?
So the main focus, and that's why I went into so much detail about skin barrier, the main focus is fixing that barrier while trying to minimize steroid use. So like for adults, anytime there's some sort of eczema or inflammatory skin condition, you kind of just throw a steroid at it. But with babies, because their skin is so delicate and that stratum corneum and epidermis is so much thinner, that means a lot more is going to get absorbed. So you want to minimize that steroid use. So, but sometimes it's unavoidable. So very low potency steroid use is used to reduce inflammation, itch that comes with that disrupted barrier. And especially because sometimes that can lead to like an itch rash cycle. And then the second part is using ingredients that will replenish that barrier. So things like ceramides, colloidal oatmeal, glycerin. And then I also like to recommend barrier creams to seal in all that moisture that we're trying to kind of push into the skin to prevent further damage. So that would be things like petroleum jelly or zinc oxide. Another very important part in managing is prevention and maintenance, right? So once atopic dermatitis can be a chronic condition, and a lot of times babies can grow out of it, but while they're dealing with it, you want to try to prevent and maintain the skin barrier. So even when the rash is gone, continuing the creams and barrier creams, even after the rash has improved, to avoid, and also things like avoiding long hot baths. So going back to kind of like the main question here, with water, water causes more transepidermal water loss, and even though it's water, it's leading to less hydration. Avoiding anything abrasive on the skin and avoiding, or at least trying to minimize certain triggers.
That makes a lot of sense. So how would you differentiate between like different types of skin conditions? like eczema, the diaper condition, like how do you know which one is which?
It depends on location and also the history, like the medical history that the parent provides. So certain things have classic locations depending on age. So for babies, atopic dermatitis or eczema in infants, they have classic locations like on the cheeks, and then flexural areas like the elbows and knees, especially when the baby starts crawling. Diaper dermatitis would obviously be more in areas where the diaper is. And then I think in one of the questions that you sent me, you mentioned like chlorine sensitivity. That because that would be a lot. In my opinion, as like a provider, would be harder to identify. Because it would just manifest as like an itchy red irritated skin anywhere on the body. But to kind of specify like it's a singular thing like chlorine, I feel like it's harder because it could be always be a combination of things.
Yeah, that makes sense.
Yeah.
So what are the main risk factors that contribute to water-related skin conditions in infants?
I think a major thing, as with a lot of medical conditions, would be genetics. You could have all the same things, like that you're doing for two different babies. But if one baby is genetically predisposed to skin conditions, then even the other baby, even if you're doing the same thing, won't experience atopic dermatitis or eczema while the other baby does. So genetics, I think, plays one of the biggest roles. And then, allergies to certain things, which also goes into genetics. And then barrier disruption. So things like bathing an infant too frequently, using products that irritate the infant's skin, and also not protecting the infant's skin with things like creams and barrier creams.
Yeah, that makes sense. Gianna, do you wanna?
Sure. So can you tell us like if there are any preventive measures that parents can take to reduce the likelihood of their infant developing any water-related skin conditions? Like something they can do?
Yeah, so it kind of like the things that I've been talking about, everything when it comes to the skin and skin related conditions, especially water related skin conditions, would be protecting that skin barrier or replenishing that skin barrier after a certain trigger. So if the issue is like if it's a water related skin condition, then limiting the time spent in water. So instead of like a 20-minute bath time, maybe making it like a 5 to 10 minute, using lukewarm water, using products that are gentle and fragrance free and not going to disrupt that barrier. So that includes anything from like body wash, creams, to even things like laundry detergent, because laundry detergent can have things like fragrances and dyes that can irritate a baby's sensitive skin. And then overall, just being very gentle with the skin while it's developing in that first year of life. Like the material of clothing that they're wearing, something that's not going to be too abrasive on the skin or too tight on the skin.
Can you explain the impact of water quality on infant skin health, particularly in areas with hard water?
Yeah, so water quality when it comes to like hard water, I think is an issue, because hard water, it's said because it has more calcium and magnesium, can disrupt an infant's skin barrier just because it's not strong enough. I didn't find too much information on this. There were some things that said that you can, and people still do it, installing like a water softener can be helpful because it decreases that calcium and magnesium. Mm-hmm. However, there was a study that was done to see if installing a water softener would help. But from what I saw, the two studies that were done, it concluded that there was only a slight reduction of symptoms. And I think it goes back to like how it's not just one thing. There's multiple factors that play a role.
Thanks. What are the typical symptoms parents should watch for that might indicate a water-related skin condition in their infant?
I think she already answered that one, like about the identification, right?
Yeah, like red, irritated, bumpy skin, correlated to like, it's hard to like, it's hard to say like, okay, it's just the water, because you know, when you look at the skin, if you see an infant that has like red, itchy, bumpy, irritated skin, and the infant is cranky, we know, you know, that if someone tells you that it's the water, then it's like, okay, every time I do this, this is what happens. But because there's so many reasons that an infant can be cranky, there's so many reasons that can cause like the sensitive skin to get red and irritated. So it might get a little hard to find that direct correlation and differentiate that it's just the water causing it. But if you see a pattern associated with those symptoms, then I would say that those would be typical symptoms, because the symptoms are broad. The skin can only present a certain amount of ways, especially for a sensitive baby skin.
So are you saying that like to determine whether it's like a water-related skin condition, you would have to like ask the parent, like if they see that the symptoms are caused after like bath time and stuff?
Yeah, exactly. Like if they're doing everything right, you know, like their bath water is not too hot, they're not taking long hot baths, they're using fragrance-free and dye-free detergent, all their clothing is like, if all the other factors are eradicated and they're noticing that it's like every time they take a bath, and even the bath, like if they're taking like 2 to 3 times a week, they're bathing their infant and they notice that every time it's causing a rash, then I think you can kind of make some sort of correlation there.
Also, would you, if the parents start seeing these symptoms, would you recommend them to see a dermatologist right away, or wait for it to like wait for them to see a pattern to determine like the severity?
No, I think if there's symptoms in general, whether it's one thing causing it or another, I think the main thing is that the baby is uncomfortable and that the barrier is disrupted. So the baby definitely needs help. So whether it's one trigger or another, I think they should still see a dermatologist to get the help and get all the things that they can do to minimize it.
Okay.
Can you discuss any recent advancements or innovations in the treatment or management of water skin-related conditions in infants?
If there are any.
Yeah, I think I feel like in the recent years, skincare has become such a big deal. And I think there's just so many amazing over-the-counter things available, so many different companies. And I think as long as you don't have to go for like the most expensive brand or like the craziest thing, as long as you know, if you know what you're looking for, there's a lot of great over-the-counter things available in terms of prescription for things like eczema or atopic dermatitis or irritant contact dermatitis. It's not that recent. It's within the last 10 years. There is like prescription creams that, so there's one specific cream called Episerum, which is the only prescription cream that is non-steroidal, drug-free, and it's literally just a prescription cream to help kind of hydrate the skin and restore that skin barrier function. And then something else that was exciting, I guess that this is like within the past like 5 years or so. There's a medication called Eucrypha. It's a topical medication ointment. And this is a non-steroidal ointment. It's still a medication, it's still a drug, but it's non-steroidal, and it was approved to be used in infants 3 months and up. So that I personally thought it was a big deal. But again, when it comes to advancements and innovations, to get approved, there needs to be so many studies and testing, which we know sometimes can be limited.
Thank you so much. This was so helpful.
All of this was such great information. Thank you so much.
You're welcome. Do you guys have any other questions?
I don't have any. Gianna, do you?
No.
Yeah.
Okay. If anything
Thank
else
you.
pops up, Asha, you can always text me.
Yes. Thank you so much.
Thank you.
You're welcome.